Welcome to the USC USAID series on COVID-19. This is training session 4, dealing with psychosocial concerns during COVID-19 pandemic. This training series was developed by the USC University Center for Excellence in Developmental Disabilities and specifically by Dr. Cecily Betts, Dr. Larry Yin, Fran Goldfarb, and Dr. Olga Solomon. The learning objectives for this session are to learn strategies to assist others in dealing with the stresses associated with the COVID-19 pandemic, and to learn some resources and videos on strategies for taking care of oneself. Recommendations for staff dealing with stresses. First of all, try to minimize watching and reading the news about COVID-19 if it makes you or your client worried. If you need to seek information from the TV or internet, try to limit the length of time that you spend doing that. Seek information from informed and credible sources such as the CDC, the Centers for Disease Control, your local public health departments, healthcare professionals, or the World Health Organization. Reach out to others by phone or through virtual connections such as FaceTime, Zoom, Skype, WebEx, or other platforms. Focus your attention on positive stories. Remember, the majority of individuals with COVID-19 have minor illnesses and get better. Promote familiar routines and have planned activities. This is a source for an excellent webinar on self-care for direct support professionals in crisis that was put together by the National Alliance for Direct Support Professionals. Here are some recommendations for supporting clients dealing with stresses. Work with the families to stay connected when individuals are under home isolation, also known as quarantined, stay in place, or stay at home, using things like FaceTime, Skype, Zoom, and WebEx. In the event that individuals become agitated, withdrawn, or anxious, encourage sharing and verbalization of feelings. Try to foster connections with family members via the virtual means that we've talked about. Engage individuals in activities that they enjoy when they are isolated, and remember to practice social distancing. Engage in some form of physical exercise, such as walking, again, using correct social distancing. Think about indoor exercises. Make every effort to maintain routines and daily schedule, including things like eating, bedtime, wake-up time, activity schedule, and provide calming and reassuring explanations when situations change. Do things like eating with disposable plates and utensils, or staff and residents using social distancing, more frequent washing of hands and use of hand sanitizers, and stay-at-home orders or the need for isolation. Here are some other resources that can help you, including an excellent document that explains COVID-19 in plain language, as well as a short video that explains coronavirus and how to prevent its spread. It's a good idea to have a list of tips to help care providers know what is calming for a person. One tool, Tips for Managing Stressful Situations, is available on the USC USAID website and includes things like things that help this person calm down or relax, things that upset this person, things that this person likes to do to amuse or entertain him or herself, things that can help when this person doesn't want to do something, and ways to tell if this person is upset or stressed. It also includes other important information. Here are some mental health resources that might be helpful. including SAMHSA, their Disaster Distress Helpline or their National Helpline, the National Suicide Prevention Lifeline. Some other mental health resources include the Treatment Locator for Behavioral Health Treatment Services through SAMHSA, as well as the SAMHSA Disaster Technical Assistance Center. Here are the references that were used in this presentation. Thank you for listening.